to reduce our refinement rate, it's the strategy we implement in our practice is one, we evaluate compliance. I'll show you what I mean by that. We do a very we plan according to specific patient biological structural limitation and patient request. So we customize the treatment based on the biological risk constraint and the patient request, and we really carefully evaluate the clean check, and we use specific mechanic and forces, and we plan for those mechanic and forces from the beginning. So compliance it's something that we have to understand when we deal with removable appliances. So there are patients that they may be 100% compliance, my patient may be like 10% compliance. So we really don't know that at the beginning, but we can sometimes approximate it. So what I do in my practice, I hope for 100% compliance, but I do not rely on it. I'm skeptical, which is why I start at 2 weeks rotation. Also, if I have a patient where the mom say, oh, I don't know if he's going to be compliant, and and the kids absolutely pushes for it, sometimes I use pre-Invisalign mechanics. For example, we use a class 2 mechanics, like a distalizer, to see if the patient is compliant. If the patient is not being compliant with that, of course he's not going to be compliant with Invisalign. Or if the patient say, well, but I didn't want to wear rubber bands, I will wear the aligner, then we need to talk about how we're going to correct this class 2. Then I talk about realistic objectives. So can we really address the class 2 if the patient is not going to wear elastic? So I discuss about other options like jaw surgery or extraction of 2 teeth, or maybe doing more interproximal reshaping. Maybe I discuss like leaving the class 2 if necessary. But we have to be realistic about what the patient is able to give us. So we can't fix everybody if they're not compliant. So sometimes we think orthodontists should just have the magic wand to fix everybody, but if they're not compliant with what we ask them to do, we can expect the malocclusion to be corrected. And so in those patients, when I worry about low compliance, then I have maybe I slow down the tooth movement, I have more realistic plan of objective, I monitor the patient closely with dental monitoring, I have some escape strategy. For example, if I know there is a rotation movement is hard, I'm going to probably plan to do cutouts instead to allow just to rely on the aligners, right? So there are different things you can do when you're worried about compliance, or you have a compliance risk of being like 100% there. Some of the best patients are over 70. I have a lot of patients over 70 because one of my offices is close to a senior home. And so in those patients, I can probably have more ideal treatment objective. I can have less frequent aligner rotation, more frequent aligner rotation. I can do more aggressive mechanics. I will probably do, instead to do 1 tooth distalization, I can do more than 1 tooth distalization. I can do more in group distalization with class 2 elastic. I can monitor, I can see every 4 months instead of the 3 months, every 6 months. So I can treat them slightly different. So once I see the compliance, at the first appointment, if I see the compliance is really good, then I can adjust my strategy based on that. So that's what I mean by customize the treatment. Not everybody is the same. So we have to use sometimes different protocol for different people.